Hello everyone. I'm really glad that I waited to make this video and I didn't make it in a series the way I started, because I've had so much input from you, so many comments and questions, that I want to start today's video by addressing the comments and the questions. And then later on, we're going to dive into the details of the formulation, the benefits and indications of the Wrinkle Texture and Repair from ZO Skin Health. So up until now, I've published 2 videos on the ZO retinols. One was on the Radical Night Repair, and the other one was on Complex A. The original video, which addresses all of the retinols, is a good one if you're interested in the basic types of formulations of the retinol itself. There are microemulsions and there are liposomes. So there are different types of technologies, and I can go over that quickly in this video, but I will reference the other ones in the description box in case you want to watch them as well. So one common question that I'm getting is when I post about a particular retinol, the question is, well, will tretinoin do the same thing? Or another really common comment is, I looked at the ingredients and, use this retinol, the ingredients are the same. In addressing the ingredients component, I cannot stress this enough. Formulators exist for a reason. I am not a formulator. I don't think most of you are formulators. There are tips and tricks and things you need to know when you're formulating products, very much like baking. I can cook, but I'm a terrible baker because I don't know the rules. Like, I remember the very first time I tried to whip egg whites and I didn't know you can't even have a drop of egg yolk in there or the egg whites won't ever froth up. You need to know those little tricks. So when it comes to ingredients, think of 2 things. Grapes. Think of wine, raisins, and fresh grapes. Completely different, same ingredient. Or think of eggs. Raw, hard-boiled, scrambled, over easy, whatever you want. Same ingredient, but completely different consistency, texture, everything. So looking at ingredients is great if you're allergic to something or you want to avoid something. And so you look at the ingredients and you determine, I'm allergic to niacinamide. This has niacinamide. I won't use it. Even then, sometimes you can try the product and it may work for you, but it is a good reference for elimination. Or if you're looking for something specific, like for example, I'm looking for a retinol or I'm looking for a vitamin C serum, and you pick up a product and it contains vitamin C or it contains a retinol. Or maybe you know the kind of vitamin C you want, whether you want ascorbic acid or you want a vitamin C ester because you're sensitive. Ingredients might be helpful because they'll tell you the type of vitamin C that's in a particular product. Otherwise, you will be best off if you leave it to the formulators because it can get misleading and confusing. A question that I get frequently was, can I use this protocol for the Radical Night Repair, which is the at-home peel protocol that I gave in that video? Can I follow this protocol with tretinoin, or can I follow this protocol with another retinol? And I want to emphasize that that particular product was designed for a peel. That particular product was tested for a peel. If you try it with another retinol that wasn't designed to be a peel, you may experience adverse reactions that are not the anticipated retinol reactions. They may be other types of reactions. For example, as I mentioned in that video, the Radical Night Repair is a superficial retinol. It works really, really well and it concentrates in the superficial skin. So if you try the same peel protocol with a tretinoin, a retin-A, even this Wrinkle Texture and Repair, you're probably going to irritate your skin too much because that retinol, the Radical Night Repair, works superficially. Tretinoin goes deep, and Wrinkle Texture and Repair goes deep. They're not designed to be peels. They're not designed to work quickly over a period of 3 to 5 days. They have a different intention and they have a different mechanism of action and a different formulation to give different types of results. So you can mix and match and you can try whatever you like, but if I tell you the Radical Night Repair is designed to be a peel, I would not suggest that you try whatever retinol you have at home and try it as a peel. It's probably just not designed for that, and you may cause yourself more harm than good. So that was a really common comment that I got. Another really common question that I got is, what's the best retinol for anti-aging? Is this Radical Night Repair better for anti-aging? And so I want to really address that in this video. And the other thing I really want to highlight in this video, especially to people that are concerned that, you know, these retinols have the same ingredients as other retinols and why bother using these? There are so many retinols out there, so many skincare lines out there, and a lot of them, even if they're a doctor brand, like Murad was a doctor, there's so many, was it Dr. Gross or Gross? There's a bunch of different doctors that have skincare lines. Truth Treatments, Osmosis, those are all created by physicians. But here's the difference. Is Dr. Zain Obagi, who created the Obagi line first and then ZO Skin Health, number one, is a dermatologist. A lot of physicians that create skincare lines are not dermatologists. But more importantly than that, he created the line to use on his patients. So it wasn't like, I want to create a skincare line so that I can sell it and make money and create a business. It was more, I want to create a skincare line because I'm missing elements in my ability to treat my patients, and I need to create products where I can address my patients' concern and treat and fix their problems. And it certainly was not for the purpose of a money grab, because Dr. Obagi is now 80 years old and he still sees patients. He could have retired decades ago and chose not to. So ZO specifically is a line meant to be used by clinicians to treat patient skin. So it's very different from a lot of other doctor-created lines, which are just created to sell. They're created to, you know, make a profit. Or, you know, I'm not, you know, they could be good products, but these physicians aren't relying on their skincare as a tool to treat their patients. At least most of them aren't. So keep that in mind. So when I say that ZO has, what did I say, 4 different retinols or 5, there's a reason, and each one is designed for a specific purpose. So I describe the purposes to you in these videos. That does not mean you can't try them for a different purpose, or you know, mix them or try them in a way that suits you. I'm just explaining to you because there are so many people who buy ZO and use ZO and they don't have the guidance of how to use the ZO products. And so the purpose of this particular series is to guide those that do want to use a ZO retinol. They don't have access to Dr. Obagi or even a ZO specialist, and they're a little bit lost in the regimen. And so my intention with these videos is to provide the education so that you can choose the retinol that can serve the purpose you're looking to get. Okay, now that we have that out of the way, let's talk about wrinkle texture and repair. The most common question I get is, which retinol is best for anti-aging? Can I use the Radical Night Repair for anti-aging? Would it be Complex A? Which one should I use for anti-aging? If you're looking for an anti-aging tretinoin-like retinol, you would reach for the Wrinkle Texture Repair. This is the mimic to a tretinoin. The design of this is to give you more benefits than just the retinoic acid and to soothe the anticipated reactions of tretinoin and to give you additional ingredients and benefits that are also anti-aging. Another question that I got is, would Complex A be a substitute for this? So again, the video on Complex A I will link below. But I want you to think of Complex A as a targeted treatment for a problem. I don't want you to think of it as a step in your skincare routine long term. It's too strong and it's designed to treat problems. It's not designed to be part of a regular skincare routine. So if you're thinking, oh, I'd like something for anti-aging, should I reach for complex A? Probably not. Now, of course, there are exceptions to that. And if you do have a ZO specialist taking care of your skin, they may prescribe it long-term, but it's in very specific cases for very specific reasons. If you're looking for anti-aging, you would look for this. This works like tretinoin, so it's going to treat the epidermis, it's going to treat the dermis, and we're going to get into that in a second. But this is safe to use long term. It can be interchanged with tretinoin if you want to, because it is the same idea as tretinoin, and it's the best for anti-aging. Why would you choose this over tretinoin? There's really two answers to that. Number one, it's slightly less irritating than tretinoin. And number two, again, the additional ingredients in the formulation that have anti-aging benefits. A little side note here to bring Skin Better Science into here, the Alpha-Ret formulation. I get this a lot. Which one is better? Which one is stronger? How are they different? Generally speaking, Alpha-Ret, you can think of that as tretinoin as well. It's more gentle than this. It's not as strong as the wrinkle texture, and it has more exfoliating properties. So when people are starting out on a retinol, I frequently start them on the Alpha-Ret system because it's just much more gentle. If I'm really targeting anti-aging and I really want to renew the skin, I will opt for the Wrinkle Texture Repair. Another question is regarding the skin restoration protocol. If you're doing the skin restoration protocol, you can use tretinoin. You can also use Wrinkle Texture and Repair. That would be fine. You may choose complex A. Again, if the skin problems are severe enough, and if you're ideally under the supervision of a ZO expert, because it's just such a strong product. Okay, so now let's talk about the anti-aging properties in this product. Number one, I did mention in the original video where I talk about all the ZO retinols, the retinol formulation in here is a micro emulsion. It's less than 100 nanometers in size. The retinol formulation in the Wrinkle Texture Repair is a micro emulsion less than 100 nanometers in size. And basically what that means, the emulsion is like a mix of water and oil with a surfactant so that the oil and water don't repel from one another. And the way it works is when you apply it to the skin, it just shoots down into the deeper layers of the dermis. So when you apply Wrinkle Texture Repair, it's really wanting to go deep. It's going to the dermal epidermal junction and ideally to the dermis. The more you apply, the deeper it will go because of the concentration distributing. Larger concentration is going to penetrate deeper into the skin. So much like tretinoin and retinoic acid at the dermal level and the dermal epidermal level, it is going to stimulate skin regeneration. It's going to stimulate fibroblasts. Fibroblasts are going to start producing more collagen. They're going to start producing more hyaluronic acid for that natural hydration deep within the skin. It's going to improve acne, dyspigmentation, and it will restructure the extracellular matrix. In addition to the actions of retinoic acid, there are other ingredients in this formulation that will help the retinoic acid do its job even better. So for example, there's a biomimetic, which means it's similar to naturally occurring sericin protein, and that is going to help hyaluronic acid production. So you've got the retinoic acid stimulating the fibroblasts to produce hyaluronic acid, but then you've got a biomimetic sericin, which also helps stimulate the production of hyaluronic acid. So you're targeting the same concern from different angles to amplify the results. And the way the sericin protein works is that it activates enzymes that help produce the heavyweight or high molecular weight hyaluronic acid. The other thing sericin does is it inhibits hyaluronidase, which is an enzyme that breaks down hyaluronic acid. So you've got the product boosting the production of heavy or high molecular weight hyaluronic acid, and then you've got the inhibitions of the inhibition of enzymes that degrade hyaluronic acid, and that's how you're increasing hyaluronic acid from two different mechanisms. In addition, this product contains plant-derived stem cells that help reduce inflammation, and we all know that chronic inflammation is what causes a lot of the skin's problems. So this particular technology is called the Z-Core technology. This product also supports the barrier function. Bisabolol, beta-glucan, and glycerin are also in this formulation to hydrate the skin and really minimize that dryness that commonly is accompanied by tretinoin. So again, when you choose this product over tretinoin, you're getting the benefits of the retinoic acid, but the idea is to really minimize all of the anticipated reactions that we don't necessarily want from using tretinoin or retinoic acid. The other thing to keep in mind when we think about anti-aging is where the aging is taking place and what the problem is. And this is where that question that I get about the radical night repair really comes into play. And again, you have to remember these retinols are designed to treat targeted concerns. So if I have a patient come into my office who has really severe sun damage, I can see that the primary aging on their skin is dyspigmentation, kind of like a leathery skin from just years and years of sun. If I can see there's a lot of epidermal damage, I may opt for the radical night repair instead of the wrinkle texture repair to first treat that superficial layer of skin. And once I've achieved the treatment and I've achieved the results from the radical night repair, then I would switch to the wrinkle texture repair and begin anti-aging the skin on a deeper level. Alternatively, if I see that I really need to treat the epidermis and the dermis, I may opt for something like Complex A to really kind of hit the skin hard and go the full thickness to get the best results. And the decision for which retinol I would reach for depends on a couple of things. Number one, again, the damage that I see. Number two, patient compliance and patient desire. What is it that bothers them? What is it that they're trying to achieve? What kind of downtime are they willing to have? And number three, the body part. If I'm treating the chest or the face or the arms or the hands or even the legs or the knees, I may choose and change between retinols depending on which area of the body I'm treating. So the main point I really want to convey to you is that if you're looking for an anti-aging retinol and you'd like to choose one from ZO, I think Wrinkle and Texture Repair is the most comparable to a tretinoin. The second thing I really want you to take away from this is that every retinol is really designed for a specific reason. And ideally, you don't want to take other retinols from other brands and try these ZO protocols, because it's like Lego blocks. If you choose another brand, the blocks may not fit. They're just different brands made for different things. So if you're doing a ZO protocol, you want to use a ZO retinol. The other thing I want to convey to you is there are more gentle retinols to start with if you want to. Skin Better Sciences has a fantastic line of retinols to go easy. And the most aggressive, most tretinoin-like retinol used for real skin problems, really treating the skin because there's an issue, that would be the Complex A. So I hope I've made that super, super clear. The next video I'm going to make is going to be on the retinol skin brighteners, but keep the questions coming, keep the comments coming, because the more you guys ask me questions and, tell me where you're not clear or where things are a little confusing, the more I can explain to you exactly what it is that you need to know. So with that, I will see you in the next video, and I'll definitely see you in the comments, and I hope you guys have a great week.